Good morning. I am Dr. Balasubramanian M.D. Let us talk about the third wave of COVID and the deaths due to it. We all know that the third wave is slowly tapering. The cases are coming down. Most of the cases are of Omicron variety. That's what the Tamil Nadu government says. So Omicron variety causes less illness, makes people all right within a 3 to 5 days duration, but a few of the people become serious, get admitted, need oxygen, and some die also. If a mild case of Omicron causes death, what is the reason? A mild case of Omicron, a mild wave of Omicron spreading so fast, covering everybody, infecting everybody, making them ill for a few days and just goes off. That is the usual pattern of Omicron variant. But a few people still die due to it. Why? If you look at the statistics, you will know most of the people who die due to third wave of Omicron COVID are either old age people or people with comorbid diseases. What are the comorbid diseases? We all know. Diabetes, hypertension, heart diseases, kidney diseases, liver diseases, etc. etc. So all these diseases are otherwise called lifestyle diseases. Lifestyle is the main reason for the severity of these diseases. These lifestyle diseases become comorbid conditions for COVID, and because of that, the severity of Omicron COVID also becomes more, and people require hospitalization, require oxygen, and die. So, our people who already have diabetes and hypertension, who could have lived for 5 to 10 years more, if not for COVID, die because of COVID. Why? There are two reasons. Because the immune status of the individuals who are having comorbid conditions are going down, and immune status of the older age people are coming down. Because of the lower immune status, these infections, especially these viral infections, conquer them and give serious illness. That is one point. We all know about it. Fine. But is that the only reason? We must see. The other reason, the most important reason, is proper control being absent among these patients. Let us take one by one. Take diabetes mellitus first. Diabetes mellitus, everyone knows. The type 2 diabetes, forget about type 1 diabetes, which is very rare in India and also comes very early in life. Type 2 diabetes is very common. It comes around 40 years of age. Middle-aged people become diabetic. Okay. What is the usual pattern of management of diabetes in our people? They become diabetic. They come to know about it around 40 years by routine tests or some rare diagnosis. They have some symptoms like loss of weight, hyper thirst, more appetite, all those symptoms becoming more. And especially when they lose weight, they become conscious. They come and consult the doctors and find out that they have become diabetic. Okay, that is the first stage of identification. But what happens after that? What happens after that? They are being carried away by the social media. The social media talks so much about these things, especially for diabetes. They say taking this thing, taking that thing, food alone is medicine. Unave marandu, food alone is medicine. That's what they preach. They are carried away easily. They don't want to take medicine. They think once we take a medicine, we will have to take lifetime. That is the concept. So they think of other alternative methods. They think of some native medicine. They think of some food, special food, so that they get rid of diabetes, which is not so. Practically, they are of no use at all. What happens in the initial stages? Just by diet restriction and exercise, walking, they are able to control to some extent, and they get overconfident. They think they are able to control diabetes They are comfortable with diet and exercise, and with some native dietary restrictions, they are happy. And they don't really bother. Few years it goes off like that. In say another 4 to 5 years, diabetes become more severe and some other symptoms appear. Then only they are alarmed. They go to the doctors and doctor says, see, your blood sugar is very high. You have to take regular treatment. All those things they say. And they prescribe drugs also. And in our country, a prescription once given is honored even for 5 years, 10 years in pharmacies. Pharmacies don't have any control. They just give tablets, whoever comes and asks, even by name. And if they have an old prescription, they are happily giving it to the patients. People are very happy. They get the tablets without consulting a doctor. They get some tablets, they continue. But diabetes is such a disease, even with proper exercise, even with same amount of diet, even with same amount of tablets, after some time your diabetic status may worsen, and they don't realize that. So such an incomplete treatment is being followed throughout our country. Even educated, rich people who live in cities go to the high profile diabetes hospitals. They give prescription for say 3 months and ask them to come for review, and mostly they continue for 6 months to 1 year the same tablets. Only when they become symptomatic again, only when they get some other symptoms, they go to the hospital. That is the pattern of diabetes management in our country. Just prescription, continuing the same prescription, not really bothering about the proper consultation. This is what is going on. And after, when 5 years it becomes dominant, after 10 years it becomes very severe. Other complications like eye complications, like kidney diseases have developed if uncontrolled diabetes is there. So, by the 10 years of history of diabetes, they have other complications also. At the stage, they are alarmed. They again go to the doctor. They go to the kidney doctor. In our country, there is a pattern of the people selecting the doctors. They just go to some doctor which they think is a specialist for their illness. They just decide. And they go to that doctor, and the doctor identifies that you have got a kidney disease because of the diabetes, all those things. And then from then on, they become chronic patients. They may be regular after that. They may be getting regular treatment after that. But the stage is, it is past the basic level. So, at that time, even with treatment, the diabetic status or kidney status is not going to get controlled. And if at all it is controlled also with riders, that is, they have other complications also. At this stage, this more than 10 years of diabetes, severity of diabetes and other complications, if COVID strikes, they become very susceptible to the severe COVID and get admitted. They have to get hospitalized and admitted. So, this is the pattern of diabetes management in our country. Similarly, in hypertension. Hypertension is also a severe comorbid condition which also affects the heart, which also produces kidney disease, and which make the people, hypertensive people, very, very susceptible to COVID complications. And the hypertension also, the same problem continues. They go to a doctor, get a prescription, and just continue without proper checking and casually checking up. And this is what happens. So, diabetes, hypertension. Less said is better about heart diseases, kidney diseases, etc., etc. If diabetes and hypertension, which are easily manageable by a doctor, by a primary level doctor, not even a specialist, the diabetes and hypertension are manageable by a primary level doctor. If they are not controlled, less said about heart disease and kidney disease, liver disease, etc., etc. So, these comorbid conditions have to be controlled hereafter, because COVID is not going to go. We are in the third wave of COVID pandemic. Maybe the fourth wave may not come, but it may remain endemic. Endemic means it will be in the community. Once in a while it will strike and we will get people infected, and who are all susceptible, like what I said, comorbid conditions, they will be affected, they will become serious. So, total number of cases will be less only, but deaths will be significant. So, hereafter, I ask all the diabetic patients who have mild diabetes or moderate diabetes to have regular checkup, regular checkup, at least once in 2 months, blood sugar, fasting and postprandial blood sugar, at least once in 3 to 6 months, HbA1c, regular checkup, not there on their own. Please take a family doctor, please consult a family doctor, have a regular checkup, see that even a mild change is corrected and your diabetic status is under control. If there is a specialist opinion needed, your family doctor will know your status, your health condition, your financial status, your activities. He will direct to the specialist accordingly. If you are not having time to consult a big high profile doctor, he will refer you to the nearest low profile doctor, but gives enough time for the patient. Such an ideal specialist will be known to your family doctor. You have a family doctor and have him direct you to the specialist. You don't go on your own. And this is my sincere suggestion. Okay. For diabetes, you have to have regular checkup, and for diabetes, you have to have blood test, etc., etc., doctor's consultation at least once in 2 years. For hypertension, what should you do? For hypertension, it is very easy. You buy an electronic BP machine, electronic BP apparatus, you have it. You see it at least once a week, and leave it, have a record on this date, at this time, this is my BP, and you have it, and you consult a doctor once in one a month, or once in 2 months, and see that if there is any difference, he will tell you. Similarly, this diabetes and hypertension patients, since there is a possibility of association of hypercholesterolemia, that means higher cholesterol. This is a part of a syndrome. Diabetes, hypertension, hypercholesterol, obesity, the increased body weight. So all these things may join together form a syndrome. So the other blood tests also the doctor will suggest you, say once in 3 months, you get it done. All these conditions, if they are kept under control, even if the COVID strikes you, you will get over it. You will not suffer. You will not suffer hospitalization. You will not suffer death. I am again repeating, people who can live another 5 to 10 years more. For example, a 60-year-old man, he can live up to 70 years. A 70-year-old man, another 5 to 10 years he can live if he has other illnesses, comorbid conditions under control, so that COVID or any other such infections, even if they attack, they will escape. It is a sincere suggestion and advice. All middle-aged people and old-age people, I am also an old man, all middle-aged people and senior citizens, take care, take your comorbid conditions seriously, take a proper doctor's consultation, and keep them all controlled and be healthy. Thank you.